anesthetic syringe is designed to support and expel anesthetic solution from a commercially prepared glass cartridge called carpool. The cartridge syringe for local anesthesia has a thumb ring handle at one of the ends of the piston. The piston is the bar which connects the thumb ring handle with the harpoon. The harpoon is used to harpoon the cartridge, the plunger in one of the bottoms of the cartridge, this plunger, this button of the cartridge, to do the aspirating maneuver. So that the syringe is called aspirating syringe for that type of carpools or cartridges. There is a lateral cartridge syringe. That means that to load the cartridge, you should insert the cartridge in a laterally way. There is another cartridge type of syringe called backwards syringe cartridge, that if you pull backwards with the bar of the piston, you release the hinge that connects both parts, the metallic part of the body of the syringe with the handle part, and you load in a back position the cartridge. Next, you pull backwards again the piston and you hold firmly the cartridge to proceed with the aspirating maneuver and confirm that you are aspirating to avoid the liquid content of the anesthetic into vessels. The other parts of the syringe are the needle adapter with a thread that where the needle are inserted, and a finger grip where you hold with the index finger and the middle finger, and between those two fingers and the thumb ring, you do the aspirating maneuver, pulling backwards with the piston. To load the cartridge in the lateral syringe, you pull backwards the cartridge, you place the plunger, the silicone plunger, in the back position, and next you pull frontward and very tightly on the clockwise sense the harpoon to hold and to avoid the cartridge to be expelled from out of the syringe. And the same you need to harpoon. Also, in the other type of syringe, you need to harpoon the cartridge to avoid the pass of the anesthetic to the vessels. According to needles, there are different types. Mostly we use the 25 or 30 gauge needles and the 27 gauge needles. One is for infiltrative technique and the other is for blocking techniques. We are going to connect firstly the short needle for infiltrative technique into the adapter, the needle adapter. You uncap tightly the cap, the plastic cap, and you get the size of this short needle for infiltrative. There is a bevel in the needle, there is a shaft of the bevel, that's the hub connector to the threaded part of the syringe, and if you shoot softly, you look some drops coming out from the bottom of the needle, from the tip of the needle. And that maneuver should be done always before shooting to the soft tissues of the patient to confirm that the needle is not blocked from the manufacturer. To cap safely the needle, you leave the cap onto the table, the surface, and you do not touch the syringe at all, only with one hand. You cap the cap of the needle and you press tightly to cover completely the cap of the needle. To unload the cartridge, you do the opposite. First, you give out the thread and you discard that needle. Of course, all our needles should be discardable needles. You leave it there on the table and you pull back from the piston and from the harpoon and you release the empty, not now, cartridge. The same with the lateral syringe. If there is a long needle placed there, look at the needles. There are two bottoms of the needle, the short and the long. The short is to be inserted in the threaded adapter of the syringe. You need to press tightly to pass through the rubber diaphragm and to connect and to thread it to the syringe. You uncap tightly and you look the different length of that 27 gauge needle. That's 3.5 centimeters length for blocking technique. The same maneuver, you look at the bevel of the needle, a bevel of 45 degrees to be placed towards bone always, and you shoot slightly some drops and release some drops to confirm that the needle is not blocked previously. To discard that needle and to unload the syringe, we are going to do the same capping maneuver, safe capping maneuver with only one hand, and when it's finished you press and you cover definitively. You turn anti-clockwise the harpoon to release the cartoon. Firstly, you remove the needle slowly, because you can have an accident in that moment if the needle is contaminated by the patient blood. You release the harpoon, as I told you, and you pull backwards from the piston and you release the cartoon from front part to the back part. And always all these discardable needles should be deposited in the yellow content for safety purposes. And that's the end.